Hello, and welcome to the first episode of AKT Boost, the podcast that's all about giving you the edge in your GP exams. I'm Dr. Iain Bolton, your host, and today we're tackling the topic of fitness to fly. As a GP, you'll often get questions from your patients about whether they're safe to fly, so let's go over the key guidelines that you need to know. First off, let's talk about what determines fitness to fly. The Civil Aviation Authority, or CAA, provides guidelines on air travel for people with various medical conditions. These guidelines help us decide when it's safe for patients to fly or when it might be better for them to delay their travel plans. Let's start with cardiovascular conditions. Patients with unstable angina, uncontrolled hypertension, uncontrolled cardiac arrhythmias, decompensated heart failure, or severe symptomatic valvular disease should not fly. This is a clear no-go. For those who have recently had a myocardial infarction or a heart attack, the guidelines vary. If it was an uncomplicated MI, they can typically fly after 7 to 10 days, but if there were complications, they should wait at least 4 to 6 weeks. For patients who've had a coronary artery bypass graft or CABG, flying is usually safe after 10 to 14 days. Those who've had a percutaneous coronary intervention or PCI, like a stent placement, may be fit to fly just after 3 days. When it comes to stroke, patients are generally advised to wait 10 days before flying. However, if they are stable, they might be clear for travel within 3 days of the event. These are important timelines to keep in mind when advising your patients. Now let's move on to respiratory conditions. If a patient has had pneumonia, they should only fly once they are clinically improved with no signs of residual infection. For pneumothorax, however, the rules are stricter. This is considered an absolute contraindication for flying. According to the CAA, patients may travel 2 weeks after successful drainage if there is no residual air. The British Thoracic Society used to recommend waiting 6 weeks, but this has recently changed to just 1 week after check X-ray shows that the lungs are clear. Now, a quick word on pregnancy. Most airlines won't allow travel after 36 weeks for a single pregnancy or after 32 weeks for a multiple pregnancy. After 28 weeks, most airlines will also require a certificate confirming that the pregnancy is progressing normally. Always remind your pregnant patients to check with the airline and get any necessary documentation. Let's talk surgery next. Patients should avoid flying for at least 10 days after any abdominal surgery. For laparoscopic surgery or a colonoscopy, they can usually fly after 24 hours. And if a patient has had a plaster cast applied, most airlines restrict flying to 24 hours for short flights and 48 hours for long flights. Finally, let's cover haematological disorders. For patients with a hemoglobin level above 8 grams per deciliter or 80 grams per litre, flying is generally safe, as long as there is no other coexisting conditions like cardiovascular or respiratory disease. Here's a quick rundown of the key information on fitness to fly for your AKT prep. So for cardiovascular conditions, anything unstable or uncontrolled, or decompensated or severe, advice is should not fly. For those who've had an MI, if it's uncomplicated, they can fly after 7 to 10 days. For complicated MIs, they should wait 4 to 6 weeks. After a bypass, they can fly after 10 to 14 days. For PCI intervention, they can usually fly after 3 days. For stroke patients, the general rule is wait 10 days, but they may be cleared to fly in as little as 3 days if stable. For respiratory conditions, such as those patients who've had pneumonia, should fly once they're clinically improved. For pneumothorax, flying is an absolute no-go. You have to wait 2 weeks after successful drainage if there's no residual air, and the BTS guidelines state 1 week after a clear check X-ray. In pregnancy, it's 36 weeks if a single pregnancy, or after 32 weeks for multiples, and a certificate is often required after 28 weeks to confirm a healthy pregnancy. With surgery, avoid flying at least 10 days after any abdominal surgery. For laparoscopic procedures or colonoscopy, it's safe to fly after 24 hours. After a plaster cast is applied, flying is restricted for 24 hours on short flights and 48 hours on longer ones. For haematological disorders, patients with a hemoglobin level above 80 grams per litre can usually fly safely. providing there's no coexisting cardiovascular or respiratory conditions. Now let's do a quick quiz to reinforce what we've just covered about fitness to fly. Let's see how well you remember the key points. Question 1. Cardiovascular conditions. Which cardiovascular condition make flying an absolute no-go for patients? Unstable angina, uncontrolled hypertension, uncontrolled cardiac arrhythmias, decompensated heart failure, and severe symptomatic valvular disease. Question 2. Myocardial infarction. How long should a patient wait to fly after uncomplicated MI? 7 to 10 days. Question 3. Stroke. After a stroke, how soon can a stable patient be considered fit to fly? 3 days if they're stable, but generally it's advised to wait 10 days. Question 4. Pneumothorax. If a patient has a pneumothorax, when is it safe for them to fly according to the updated guidelines? One week after clear check X-ray, or 2 weeks after successful drainage if there's no residual air. Question 5. Pregnancy. At how many weeks is air travel typically restricted for a single pregnancy? After 36 weeks for a single pregnancy. Question 6. Surgery. How soon can a patient fly after laparoscopic surgery or colonoscopy? After 24 hours. Question 7. Haematological disorders. What is the minimum hemoglobin level generally considered safe for flying, assuming there are no other health conditions? 8 grams per deciliter or 80 grams per litre. And that's it. That's your quick guide to fitness to fly. These guidelines are not only useful for your AKT exams, but also essential for patient care in everyday practice. Remember to always check the latest CAA guidelines and consider each patient's unique situation before giving advice. Thanks for listening to AKT Boost. Make sure to subscribe and stay tuned for more episodes packed with tips and insights to help you ace your GP exams. I'm Dr. Iain Bolton, and I'll see you next time. Happy studying and safe travels.